you all to this wonderful program, and this is a certificate course. So you must all attend all the modules and try to be on time, right? So, my topic for today is murder and mortality attributed to tobacco use and oral cancer in India. So, tobacco, as you all might be knowing, that it is the leading cause of preventable deaths as per the WHO report 2003, and it kills almost 8 million people each year. And 1 billion people will die from tobacco use this century. Tobacco is now the world's leading single agent of death. And it is also important that it kills almost half of the people who uses use it as required. Tobacco burden globally is more in poor and developing countries. It has got high public health costs attributed to it, kills people at the height of their productivity, and poor spend almost, some of the poor, they spend almost 10% of their income, which is a lot. So two-thirds of the world's smokers, they live in 10 countries, and more than 40% in India and China. So that is really alarming. And it is a risk factor for six of the world eight leading causes of death, except for HIV, AIDS, and diarrheal diseases. So it leads to almost all the non-communicable diseases. So this is important. So it leads to ischemic heart disease, it leads to cerebrovascular accidents. Then the low respiratory tract infection is common with this. Then the chronic obstructive pulmonary disease (COPD) it is common with it. Tuberculosis is attributed. I mean, most of the deaths in tuberculosis they occur because of the usage of tobacco simultaneously. And then the lung cancer, that is also it is the leading cause. Tobacco is the most important risk factor for it. So smoking and secondhand smoke, they lead to the same diseases, almost the same diseases, like cancers and the chronic diseases. And there is no part in the body because the basic chemical here is nicotine. Nicotine causes vasoconstriction, and and all the organs in the body and the tissues in the body, they have blood vessels. So you can say that it leads to almost all diseases from head to toe, from hair to the toes. Then the recent scientific evidence diseases due to active smoking. So active smoking means passive smoking along with it. So it leads to cancers, all kinds of cancer like leukemia, nasal and oral cancer, then larynx cancer, pharynx cancer, esophageal cancer, lung cancer, liver, stomach, pancreas, kidneys, cervix in women, ureter and bladder. It can lead to cancer anywhere in the body. So these parts are important. Other diseases, as I told you, that no part in the body is immune to the tobacco-related diseases. So it may lead to stroke, cataract, and in the eyes. It may lead to uh, macular degenerations also. And then there's diminished health is there. Overall diminished health is there. Coronary artery disease, atherosclerotic peripheral vascular disease, or popularly known as Buerger's disease, is very common with it. Aortic aneurysms are common. Chronic obstructive pulmonary diseases attributed to tobacco use. Then the burden of tobacco deaths is shifting from developed to the developing countries now. And one in long-term smokers killed by their addiction. One in two long-term smokers, as I told you earlier also. So, and half of the deaths are in the middle age. That is the most important age, the earning age, 35 to 69 years, the people that get killed. Youth, global tobacco burden. So 10,000 youths, they become regular smokers every day all over the world. One-fifth of young people, they begin before they are 10 years of age. And then there's exposure to second-hand smoke is very high. And it is predicted to kill 250 million children and adolescents alive today. The tobacco burden in India, the GATS survey is systematically monitoring adult tobacco use, that is between the 15 and above age group, is all included in this. And it is done in 30 states and two union territories like Chandigarh and Puducherry. And it covers almost 99.9% of the population. So the sample size is quite big. 74,000 is the sample size. So we can rely on this. And the GATS 3 is also going to happen very soon. So tobacco burden in India, total it is 28.6%. So that means about 267 million people, they are users of the tobacco in any form, like smokers. It is 10.7%. And the chewers is 21.54%. So in India and South Asian countries, so there are more usage of smokeless tobacco than the smoking tobacco. Then, as per the GYTS, that is Global Youth Tobacco Survey 4, that was in 2019. So 13 to 15 years school students, it is done in the 13 and 15 years of the school students. So it shows that 8.5% use tobacco, and more in boys and little less in girls. Smoking is 7.3% and smokeless is 4.1%. 11.2% live in the homes where others smoke in the presence. That is, exposure to second-hand smoke is very, very high. So it is as high as 11.2% at home. Then burden of tobacco in India, it kills almost 13.5 million lakh people annually. And some people, they say even 26 lakh, but this is an authentic figure, 13.5. Uh, Authentic in the sense that it is commonly used. So 26 lakh is not a non-authentic figure. It has come in some of the studies also. And there are about 3,700 deaths per day. 50% cancers in men and 25% of women, cancers in women, they are attributed to usage of the tobacco. And there's very, very high incidence of oral cancer in the world. Burden on tobacco use continued. So 40% of the TB deaths in male, they are associated with smoking. Impotence is 85% higher among the smokers. And there's also very huge environmental burden attributed to smoking. So as I told you about the NCDs, so 6.4 million deaths per year in India due to the non-communicable diseases. So mostly because of the tobacco use, and also because of the unhealthy diet, physical inactivity, harmful use of the alcohol also. These are also the risk factors for the NCDs. In India, oral cancer is a significant health concern, and an estimated 52,000 deaths they occur annually because of the oral cancers. 33.3% of global oral cancer related fatalities are there in India. 33.3% of the global oral cancer related fatalities. So that is quite high. And research from Wiley Online Library estimates that oral cancer was a leading cause of cancer deaths in several Indian states. So where the usage of smokeless tobacco is high. So as per the Indian Cancer Society, India has the highest prevalence of oral cancers globally. As I told you, 33%, more than 33% of the global oral cancer-related fatalities are in India. So oral cancer is a leading cause of the cancer death in India, with over 5 people dying every hour. That is quite high. So as far as the global burden is concerned, India bears a disproportionately large burden of the oral cancer, accounting for a significant percentage of the global case and deaths. And it is because of a lack of the means for early detection, and people, they are not aware about that. They think that oral cancer, the usage of the oral tobacco is okay. The use of the pan masala and or the gutka is all right. So when you mix pan masala with the tobacco pouches, it becomes gutka. So there's lack of awareness and early detection. As I told you, the means are less. Risk factor: tobacco use is a major risk factor, as I told you earlier also, for the oral cancer. Survival rates in India are lower than in the developed countries, partly due to the later stage of the diagnosis, and there's limited access to the advanced treatments also in India. And as far as the environmental burden of tobacco is concerned, up to 10 billion cigarettes are disposed of in the environment every day. Environment means water, air, and land. So, so uh, every kind of environmental degradation is there. So 7,000 toxic chemicals are there, and cigarette butts estimated in India thir account to about 30 to 40% of the items collected in the coastal and the urban cleanups. So mostly they are the cigarette butts. The estimated use of the wood is 7 to 8 kg used to produce 1 kg Virginia class tobacco. That is quite high. So to produce 1 kg of the Virginia class tobacco, which is the best tobacco found anywhere in the world, so 7 to 8 kg of the wood is used to cure it. So 6.3 trillion cigarettes they are smoked globally every year, and it is estimated that 18 lakh tons of waste paper, cellophane, foil, and glue that is being used for packaging of the cigarettes, and even used for the packaging of smokeless tobacco. So trillions of cigarette butts, that is 10 billion per day, are littered on roadways, pavements, and in parks and in other green spaces. In India, more than 100 billion cigarette butts are being dumped in every year. So that is quite a lot. As far as the economic cost of the tobacco use is concerned, total annual economic cost is INR 1,77,000. This was estimated in 2017-18. And out of this, direct cost is 22% and indirect is 78%. For every INR 100 received as excise tax from tobacco products in 2016 and 17, society incurred INR 816 of cost through the consumption of the tobacco. So almost more than 8%, 8 times the cost is there because of the treating diseases related to the tobacco. So just 100 rupees is earned by the government, and more than 800 is spent by the society. So maybe by the government it is more than that. So smoking attributable costs amounted to INR 1,30,922 crore, and SLT attributed costs were INR 46,419 crore, that is 26%. So mostly it is related to the smoking attributable cost is related to smoking, and SLT that causes 26% of the damage. So the source is the Journal of Nicotine and Tobacco Research, 2020. So the economic costs of the disease also, prevalence of the disease has though been reduced by 17%. Relative reduction is there. The estimated economic cost for the 17-18 is 21.5% higher in real terms compared to 2011. So it is recommended that we must increase taxes, and that taxes should be increased across the board. That is, all kinds of tobacco should be involved in the increased taxes. And their increased investment in the National Tobacco Control Program is also required to control the tobacco. And to summarize, tobacco is the leading cause of preventable premature mortality worldwide. The tobacco attributed deaths are projected to increase from 7 million a year to 8 million a year by 2030. And as per the GATS 2 survey in India, 28.6%, that is about 268 million people, they are using tobacco in any form above 15 years of age. Tobacco use is a major risk factor for NCDs. Tobacco use causes huge health, socioeconomic, and environmental burden in India. So NCD Action Plan aims to achieve 30% reduction of the tobacco use by 2025. So this is to summarize it all. So I am open for any questions if you have any. So I'll stop sharing my slides.